My name is Ingrid Harm-Ernandes. I've been a pelvic PT for about 27 years and a physical therapist for about 39. One of my most recent endeavors is writing a book called The Musculoskeletal Mystery, How to Solve Your Pelvic Floor Symptoms, and just so glad to try to get that information out to everybody. Patients come in and say, I don't want to go for a pelvic exam. It is so painful. If that person knows that they're going to go to this exam and have pain, those muscles are going to tighten further. The anxiety around it will start the muscles to get tighter. The exam is going to be even more uncomfortable. So it becomes a snowball effect. Even if they can convince themselves to go for the exam, their muscles are doing this. And if someone just pats them on the shoulder and says, oh, you'll be okay, honey, it makes it even worse because now it's like, well, you just think I'm making this up. So you can see this snowball effect that nobody seems to want to address. I teach nurses and PAs and doctors how to do comfortable exams, and I blow their mind. They come up to me after I've taught the lab and they say, Ingrid, I never thought of it that way. I could have totally prevented the pain that my patient was having. I could have done an appropriate musculoskeletal exam and known what was happening. And I said, well, that's why I do this. That's why I have to thank Arjun so much for allowing me to speak about this. Because if a person steps forward who has a vagina and says, I have this issue, please work with me, we're already changing the whole concept. We're changing everything. I feel passionate about that because I want to change the concept that pelvic exams and things associated with our vagina have to be painful. They don't. There are lots of things we can do. I would counsel my patients on everything from relaxation techniques, breathing techniques, muscle stretching. And when they were ready to have their exam, I would say to them, okay, we've taken care of all of this. Now here's a job for you. You need to talk to your practitioner first. You need to blame it on me and say, my physical therapist told me that I need to breathe first, that you need to breathe first, that we need to take it slow, that I need, as the patient, to be able to guide the speed of the exam and the degree of the exam. I know that's a hard road, but you have got to advocate for yourself and for the next woman walking in the door. Now that practitioner says, wow, that exam went much easier when we did it that way. Why don't I do it for everybody? For years, women's health still seemed to be so separate from our pelvis. It was okay to talk about breast health. People aren't willing to say vagina, vulva tissue. The healthcare provider themselves might not be comfortable bringing the subject up, so they don't ask about it. And if the patient's not comfortable with bringing it up, they don't talk about it. And so even if you're educated, it's still kind of back here until we normalize the conversation, not the problem. We normalize the conversation. So everybody says, well, it's okay to say those words. And if I have pain with sex, it's okay to talk about that. If we normalize the conversation, then everybody benefits from it. That's the key thing. And pelvic PTs are perfectly poised to do that because we talk about it all day long. So I have always said from the moment I started being a pelvic PT, I wish I had every 18-year-old come in the clinic so we could do an assessment and we could say, this is what's going on. This is what you need to do. You're good to go. And I think that's where we need to head with pelvic PT, is this open relationship through a lifetime. If we can do a good job working with our patients through life, we can really help people not have problems later or minimize risk. I think that's educating providers better. Family medicine, OBGYN, gynecology, urology. I'm even going to talk to mental health experts to have them recognize that other things may be going on. I'm going to talk at a dental office to show them that things like teeth fracture, bruxating, clenching your teeth often has a strong relationship with pelvic floor problems. So these things seem so uninterrelated, and they're very interrelated. I think think it's because we're so comfortable. We've dealt with these things so long, we're comfortable. And the fact that we're comfortable shows that this is okay. You are here and we're going to shut the door and we're going to talk about you. And we're going to let you talk about whatever you need to help you. And I think a pelvic PT is so comfortable doing that, that the patient just opens up. Now, I've been so honored that patients open up to me and have talked to me about so many different things, because I think it made me the better clinician. And I feel like other clinicians are missing out when their patients don't open up and don't allow us to help them better. If you sense you're having leakage, pain, urinary incontinence, fecal incontinence, constipation, pelvic pain, hip pain, back pain, pain with sex, IBS, interstitial cystitis. If you sense any of those symptoms, this book is for you, because you're going to be able to read about all of this and feel very comfortable discussing it with anybody.